In patient care, there are a number of instances where the patient will need to roll to one side of the bed, maybe to change the sheets of the bed, or to provide treatment, or perform an assessment. Some patients will be able to accomplish this without assistance, but others may need varying degrees of assistance from a provider. If a patient has some ability to move in the bed but requires support from a provider, utilize this technique. Begin by raising the bed to waist level. Bend the patient's opposite knee and have the patient reach across their body with the opposite arm to grasp the bed rail towards the side they are rolling to. You will provide guidance and support for the roll from the scapula, or shoulder blade, and from the bent knee, so place a hand at each location. Then position yourself with a wide stance that provides you a strong base of support. Count to 3.
1, 2, 3.
And aid in facilitating the roll through support on both those points of the patient's body. When you need to help the patient return to a supine position, provide support at the scapula and knee and simply guide the patient as they roll to their back, and extend the leg. For a patient that requires more assistance with the roll, you can utilize this technique. Again, begin by raising the bed to waist level. Cross the patient's opposite leg at the ankle. Reach the patient's opposite arm across their body. Again, position yourself with a wide stance to provide yourself a strong base of support. Use the sheet to assist the roll. Take hold of the sheet at the patient's waist level and shift your weight back as you roll the patient toward you and onto their side. To return the patient to a supine position, you could use the sheet to assist if necessary, or provide support at the scapula and knee as you allow the patient to roll to their back. Then uncross the legs.